You know that feeling, that constant worry when your dog just isn't quite right? And those health problems that seem to keep coming back no matter what you do. It's just incredibly frustrating.
It really is.
So today we're digging into one of those really puzzling issues. Why some dogs get these recurring skin infections and how it can sometimes be linked to something called canine Cushing syndrome.
Yeah, it's a surprising link for many. This deep dive is really for anyone who's maybe gone through those repeat vet visits, for skin problems, or maybe you're just curious about how different parts of a dog's body can connect in, well, unexpected ways.
We've pulled together some really solid information for you here. We're looking at articles from DVM 360, Iowa Veterinary Specialties, the MSD Veterinary Manual, PetMD, VIN, Vet Times, and some helpful insights from DECRA UK, too.
A good spread of sources.
Definitely. And our goal today, our mission, if you like, is pretty straightforward. Really get to grips with how these recurring skin infections, pyoderma, can signal Cushing's, how vets actually figure this out, and what the options are.
Sounds good. Let's get into it.
So this connection, it's not always obvious, is it?
Not at all. What's fascinating, I think, is that while we often think of Cushing's with those, classic signs, the pot belly, the hair loss, drinking and peeing more.
Yeah, the really noticeable things.
Exactly. But these recurring skin infections, they can be much more subtle. And sometimes, honestly, they might be the only thing you actually see on the outside.
Right. And that DVM 360 article we looked at, it had that picture, figure one, of a dog where that was exactly the case. Just the skin infections were the main clue, which really drives home how easily Cushing's could be missed if you're only thinking skin problem. So, okay, these repeat infections, what exactly is pyoderma?
So superficial pyoderma, essentially it's a bacterial skin infection, usually staph bacteria. And it's very common in dogs.
Okay.
Now, when it keeps coming back, the underlying reasons tend to fall into two main camps: allergies or hormonal imbalances, endocrinopathies.
Allergies and hormones. Got it.
And there's sometimes a clue in the dog's age. Dogs with allergies, they often start showing signs when they're younger. But if these skin infections suddenly start cropping up when a dog is middle-aged or older,
Oh, okay.
that tends to make us think a bit more about those endocrine issues like Cushing's or maybe hypothyroidism.
That makes sense. So if a dog is battling these repeat infections, what are the main goals for the vet beyond just, clearing up the current flare-up?
Well, there are really two key goals. First, obviously, treat the active infection effectively. Often topical treatments are great for this. But second, and arguably more important in the long run,
Find the root cause.
exactly, identify and then treat whatever underlying issue is allowing these infections to keep happening. And this is getting, increasingly important because we're seeing more antibiotic resistance.
Oh, yes. The DVM 360 article mentioned that. Figure 2, right? The rise of MRSP.
Methicillin-resistant Staphylococcus pseudointermedius. It's a real challenge.
That's the one that doesn't respond to some common antibiotics. Sounds tricky.
It is, and it really highlights why we can't just, keep throwing systemic antibiotics at every recurring skin issue.
But what's the alternative?
Well, the DVM 360 article points to how effective topical treatments can be, especially things containing chlorhexidine.
Yeah.
Sometimes it's combined with other agents like Giuseppa Tricolor 4 is an example.
And that comes in different forms.
Yeah, shampoos, sprays, wipes, lots of options. And using these regularly can really help manage those surface infections, reduce how often they pop up, and hopefully cut down the need for those oral antibiotics.
Okay. So say you've kind of ruled out the obvious allergy signs, the itching, the redness, and typical spots.
Right, if that doesn't seem to fit.
Then the focus shifts more towards these endocrine diseases like Cushing's or hypothyroidism.
Precisely. They become key suspects.
Okay, so let's dive deeper into Cushing specifically. Hyperadrenocorticism is basically too much cortisol production, isn't it?
That's the heart of it, yes. Too much of the stress hormone, cortisol. And there are a couple main ways this happens internally, what we call endogenous Cushing's.
Okay.
The most common type, responsible for maybe 80–85% of cases, is pituitary-dependent hyperadrenocorticism, PDH.
Pituitary dependent, so the pituitary gland is involved.
Exactly. There's usually a small benign tumor on the pituitary gland, often in specific parts, called the pars distalis or pars intermedia. This little tumor pumps out too much of another hormone, ACTH,
And ACTH tells the adrenal glands.
to produce cortisol. So too much ACTH means the adrenal glands go into overdrive, producing way too much cortisol.
Okay, that's the majority. What about the rest?
The other main type, about 15–20% of cases, is adrenal-dependent hyperadrenocorticism, or ADH.
So that's a problem with the adrenal gland itself.
Correct. In ADH, there's a tumor directly on one of the adrenal glands, churning out excess cortisol all by itself. And interestingly, the other adrenal gland, the one without the tumor, often shrinks because the body's normal feedback loops are suppressed by all the extra cortisol.
Fascinating. So pituitary driving the adrenals or an adrenal tumor itself.
Right.
But the end result is too much cortisol.
Yes. And that excess cortisol has widespread effects, including suppressing the immune system in the skin, which makes it easier for those infections, the pyoderma, to take hold and keep coming back. That's the crucial link for you, the listener, to grasp.
Right. And there's also the type caused by medication.
Yes, good point. We should briefly mention iatrogenic Cushing's. That's not caused by an internal tumor, but by long-term administration of steroid medications, like prednisone.
Okay, so for the internal types, PDH and ADH, are there certain dogs more likely to get it?
Generally, yes. Both types tend to show up more in older dogs, and often in dogs that are overweight. The Iowa Veterinary Specialties article also pointed out some breed tendencies.
Ooh, like what?
Well, PDH seems more common in smaller breeds. Think dachshunds, beagles, poodles, various terriers, miniature schnauzers.
The little days?
Often, yeah. Whereas ADH, the adrenal tumors, seems a bit more frequent in middle to large breeds and maybe slightly more often in females.
Interesting. So if a vet suspects Cushing's, maybe because of the recurring skin issues or other signs, what clues might they find in just routine blood tests, even if it's not definitive?
Right, so a standard blood count, chemistry profile, and a urinalysis can give some valuable initial clues. They provide baseline data.
What sort of things might they see?
In a dog with Cushing's, you might see certain patterns in the white blood cells, like high neutrophils, low lymphocytes, low eosinophils, sometimes called a stress leukogram.
Okay.
You might also see elevated liver enzymes, particularly alkaline phosphatase, maybe high blood sugar, and often the urine is quite dilute, a low specific gravity, say less than 1.020.
But these aren't guaranteed.
Definitely not. And importantly, as the DVM360 article mentioned, in the early stages of Cushing's, you might see very few or even none of these changes in the routine blood work. They're suggestive, but not diagnostic on their own.
Right. So if those subtle clues, or maybe just those persistent skin infections, make the vet suspicious, what's next? How do they screen for it more specifically?
Okay, so the next step usually involves more specific screening tests. A common starting point is the urine cortisol-creatinine ratio, the UCCR.
Ah, and that's the one where you, the owner, can often collect the sample at home.
Exactly. Usually the first morning urine sample, and ideally collected a couple of days after a potentially stressful vet visit to try and get a baseline cortisol level.
Less stress, more accurate result. Makes sense.
It's relatively non-invasive, fairly inexpensive, a good initial screen, but it's crucial to understand its limitations.
Like what?
Well, the UCCR can have false positives. Other illnesses, even just significant stress, can sometimes elevate it. So a high UCCR doesn't confirm Cushing's, it just tells us we need to do more testing.
But what if it's normal?
Well, a normal UCCR is actually quite useful. It makes Cushing's much less likely, so it can often help rule it out.
Okay, so UCCR is high, suspicion remains. What are the main confirmation tests?
The two big ones used to confirm Cushing's are the low-dose dexamethasone suppression test, the LDDS test, and the ACTH stimulation test.
LEDS and ACTH stem.
Right.
Are they used interchangeably?
Not always. For dermatology patients where maybe recurring pyoderma is the main issue, the LDDS test is often preferred. It tends to be a bit more sensitive, meaning it's better at picking up Cushing's when it's there.
But are there times when the other test is better?
Yes. The DVM360 article points this out. If a dog has other significant health problems going on at the same time, like diabetes or kidney failure, or if they've been on steroid pills long term.
Okay.
The LDDS test can sometimes give a false positive result in those cases. So in that situation, the ACTH stimulation test might be the more reliable choice for confirmation.
And imaging. Does that play a role?
Absolutely. Abdominal ultrasound can be very helpful. It allows the vet to actually look at the adrenal glands, see if one or both are enlarged, or if there's evidence of a tumor.
Right. So putting it all together, history, clinical signs like the skin issues, blood work clues, screening tests, confirmation tests, maybe ultrasound. It's a process.
It's definitely a diagnostic process, putting the puzzle pieces together.
And if, after all that, Cushing's is confirmed, whether it's pituitary or adrenal, What's the usual approach to treatment?
For both the common types of endogenous Cushing's, the medication most often used first is called trelastane. The brand name is commonly Vettori.
Trelastane. Okay. How does it work?
It works by reducing the amount of cortisol the adrenal glands produce. It's typically started at a fairly low dose, usually given with food, maybe once a day initially. The dose is often around 2.2 milligrams per kilogram of the dog's body weight to start.
So it sounds like if those recurring skin infections are the main thing you're seeing, and the vet suspects Cushing's, they have a clear path to investigate and potentially treat it.
Yes, there's a pathway. But starting treatment isn't the end of the story.
Ah, right. It's not just give the pill and forget it, is it? There's monitoring involved.
Absolutely crucial. Ongoing monitoring is key. After starting trelastane, the dog needs follow-up testing. Typically, ACTH stimulation tests are done around 10 to 14 days after starting, and then again at the 30-day mark.
What are they looking for with those tests?
They're checking how well the medication is working, has the cortisol production come down appropriately, and importantly, they're making sure it hasn't dropped too low, a state called hypocortisolemia, which can cause its own problems.
So finding that right balance.
Exactly. And if things look stable after the first month, those monitoring ACTH stim tests are usually repeated every 3 months or so. But it's not just about the tests.
Owner observation, too.
Hugely important. Owners need to watch their dog closely for any changes, appetite, energy level, any signs of being unwell like vomiting or diarrhea, and report them to the vet immediately. Regular blood tests to check electrolytes and other things are also part of long-term management.
That DVM 360 article had another picture, figure 3, showing a dog whose skin really improved after treatment, didn't it?
Yes, it showed a dog treated with both trelastane for the Cushing's and topical therapy for the skin infection, illustrating how managing the underlying cause can lead to significant improvement.
It really brings it together. And I thought Dr. Lewis's point in that article was really pertinent, too.
Which part was that?
About antibiotic resistance. He emphasized how, because resistance is increasing, finding and treating the underlying cause of recurring pyoderma is just so critical, and he specifically named Cushing's as a known significant cause to look for.
Yeah, it's a really important perspective. We can't just keep managing the surface problem indefinitely.
Definitely. So we've established Cushing's as this potential, sometimes hidden cause behind recurring skin issues. But are there other conditions that might present with similar signs, especially those other classic Cushing symptoms like drinking and peeing a lot?
That's a very good point to bring up, because differentiating is key. Our sources do mention other conditions that cause that increased thirst and urination, polyuria, and polydipsia, or PUPD, and these can sometimes muddy the waters initially.
Like what?
Well, one condition is diabetes insipidus.
Ah, yes, diabetes insipidus. Now, that's totally different from Cushing's or the more common diabetes mellitus, isn't it?
Mm-hmm.
It's about water balance.
Exactly right. It's not about cortisol or blood sugar. Diabetes insipidus involves a hormone called ADH antidiuretic hormone. Either the brain isn't producing enough ADH, which is central diabetes insipidus, or the kidneys aren't responding to the ADH that is there, which is nephrogenic diabetes insipidus. In either case, the kidneys can't conserve water properly, leading to huge amounts of very dilute urine and consequently intense thirst.
And the sources, like the MSD manual and PetMD, mentioned this can be congenital or develop later, linked to other things sometimes.
Yes, causes can range from pituitary issues, kidney disease, certain medications, even head trauma in some cases. So while the PUPD sign overlaps with Cushing's, the underlying problem is completely different. It's water regulation, not cortisol.
Okay. And then there's the other diabetes, diabetes mellitus, the one most people are more familiar with.
Right, and that one is about blood sugar. It's caused by either a lack of insulin or the body's inability to respond to insulin properly.
And that also causes increased thirst and urination.
It does, yes, but usually alongside other signs like increased appetite and often weight loss. Though, confusingly, weight loss can sometimes happen in Cushing's too, especially if they have diabetes mellitus concurrently.
Okay, so they can happen together.
Yes, absolutely. The Merck Veterinary Manual notes that things like age, breed, obesity, and other hormonal conditions, including Cushing's itself, can predispose a dog to developing diabetes mellitus. Having both conditions at once definitely makes diagnosis and management more complex for the vet and for you, the owner.
Good to know. And I think the Vet Times article also briefly touched on hyperthyroidism.
It did, but mainly to note it's primarily a cat disease. While hyperthyroidism in cats can cause signs like increased thirst, urination, appetite changes, and weight loss, some overlap with Cushing
It's
signs.
rare in dogs.
Very rare in dogs, and when it does occur in dogs, it's usually linked to a cancerous thyroid tumor, often presenting as a noticeable lump in the neck rather than the more systemic signs seen in cats or dogs with Cushing's.
Okay, so pulling all of this discussion together, it really underscores how important a thorough investigation is, doesn't it? Especially when a dog has signs like recurring skin infections or that excessive drinking and peeing.
Absolutely. That recurring pyoderma, it might just look like a skin issue just on the surface, but
But
as we've seen, it can be a really significant flag pointing towards something deeper like Cushing's disease operating underneath.
right, it's not always just skin deep.
Not at all. There needs to be a comprehensive diagnostic approach, especially when you have these persistent infections that don't have a clear allergic trigger or when other suggestive signs are present.
So the big takeaway for you listening today, those skin infections that just won't quit, particularly if your dog is middle-aged or older and allergies don't seem to be the full story, well, they really warrant a deeper look. It might be time to talk to your vet about screening for endocrine conditions like Cushing's.
hmm And the crucial message here is about partnership. Work closely with your veterinarian if your dog is facing these persistent health issues. It really is about digging beneath the surface symptoms to find and hopefully treat that root cause rather than just managing flare-up after flare-up.
Which brings us to a final thought for you to ponder. Have you ever noticed health issues in your own pet that seem, well, unrelated on the surface? Could there be an underlying connection that hasn't been explored? It just highlights the complexity of internal medicine, doesn't it? And the real value of a thorough veterinary investigation to see the whole picture.